Jasmine, as pharmacy professionals, we're expected to seek out and examine appropriate evidence. We must find credible and reliable sources, apply professional judgment to analyze them, and consider how they apply to our patients' unique circumstances and preferences.
We do, and 5 steps of the evidence-informed practice process will help you structure your decision-making when providing care to patients. You need to ask the question, acquire the evidence, appraise the evidence, apply the evidence, and finally assess the outcomes.
To ask the question, you need to clearly define it. Structure your question using a tool such as PICO, Population Intervention Comparison and Outcome, to narrow down what is known, what remains uncertain, and what requires clarification.
Then acquire the evidence. Always focus your search on the strongest available evidence. Look at resources at the top of the evidence-based information pyramid, systems, summaries, and guidelines, and so forth. Depending on the complexity of the question, you might need to review sources of evidence lower down the pyramid, like systematic reviews or individual studies.
To appraise your evidence, you need to consider study design and methodology. How were the participants selected? Was blinding used? How did they report the results? Not every question is going to have strong or conclusive answers, and that's okay. You need to consider the strengths and limitations of your evidence and apply professional judgment to inform your decision-making.
Now on to the big step, applying the evidence. Once you've gathered the information, use your professional judgment to determine how it relates back to your patient. If you're still unsure, use this opportunity to collaborate with other healthcare providers.
And above all, explain the evidence and the decision-making with your patient. They don't want to hear jargon or statistics. Explain in plain language, and explain the links found between the evidence and their unique situation.
Consider their circumstances and preferences and make decisions together. Invite questions, address concerns, and encourage their input. Then make sure you document everything to clearly record your rationale and the plan you've both agreed to.
Finally, assess the outcomes. Did your plan have the desired effect? Were your patient's health goals achieved?
You can also reflect here and identify areas for professional growth. Are there additional things you want to learn more about to improve your practice?
An evidence-informed practice helps us pharmacy professionals to deliver safe and effective care. By finding and evaluating information, applying professional judgment, and communicating to your patient, you can provide quality, person-centered care.
For more information on evidence-informed practice, review the detailed walkthrough in the Advice to the Professions document. Thank you for joining us.